Okay.
When you're ready. Tell me.
Action.
Good. Okay. All right. So I'm Jim Harwood, and this is the home exercise program for Sparrowbush, which is not a real name. Okay. So first of all, I just wanted to reiterate what we talked about. The fact that you are motivated to do your exercises and all, which is all great. The key is technique. You always have to have the best technique possible, right? At your stage of your recovery, your range of motion is really doing well, but we still want to get more range of motion, and then we got to really start strengthening, okay? Um, what's important to understand too, as we get into it, the difference between what an isometric exercise means. Like when I talk about a quad set or a hamstring set, those are isometric. That means there's a muscle contraction, but there's no movement. Like if I had my fingers and I'm pushing into each finger, I feel my muscles contracting, but there's no movement of any joint. There's no change of positioning. That's what an isometric is, and that's important for the first couple exercises we're doing. I always talk about breathing too. Whenever you're exercising, if you have to hold it for a certain amount of time, I never do it based on time. I always do it based on breaths. What else was there? And then I'm a big believer in most of your exercises be connected to your core. As I discussed with you when you were on the bike, you want to feel like the movement is coming from your center. It's not just kind of arbitrarily happening in the periphery. With that in mind, let's go over the quad set and hamstring set. So you're lying down. I'm actually, because it's closer to the camera, I'm showing everything on the right leg. Obviously, your leg it's the left leg that you're concerned with, but it doesn't really matter. So quads, hamstrings. All right. So when I'm doing a quad set, the whole point of a quad set is to be able to turn this muscle on so that my knee gets straighter or goes down into the table. So to make it easier to feel and understand, I usually tell people to grab a towel or something, put it under the knee. So now the knee is a little more flexed. So you'll feel it more. So I typically tell people to bend the other side, have just slight core contraction. So I'm just putting a little tension in my belly, bringing my belly button down. I'm not flattening my back, because then that would be the opposite direction, just slight tension. So what I'm going to do is I'm just going to tighten this muscle so I feel my knee go down into the towel. I'll hold it for maybe 2 or 3 breaths in and out. And then relax. So that's a quad set. Okay, now, if I want to add to that, I could do a quad set, but then when I do the quad set, I can lift my foot off the bed. Are you getting that, Aya? My foot?
Yes.
Good. Notice when I did a quad set, my foot didn't really change its position. Now what I'm doing a quad set, but I'm lifting my heel. So now I'm getting a lot more extension in my knee. Again, I can hold that. That's a step up from a quad set. The bigger this is, like if I had this pillow here, and I did it. So now I'm doing a quad set. Now if I lift, I have a longer range to feel the difference of my foot up and down, because my knee's starting more flex. So then when I lift my ankle or my foot, I'm getting this is what they call terminal knee extensions. The names don't matter. Just know that the first one was a quad set. The second one, I do have a change in my joint because my foot is lifting. Okay, so that's your quad set, and you're lifting the ankle, which works the quad more. The next thing we talked about was the hamstring heel slides and then the hamstring sets. So one of the exercises you had is you just bring in the heel, sliding it along the table. I know the sheet is moving. Trying to get it back as close to your buttocks as possible. That's just to try to get more flexion range in my knee. So I'm just doing heel slides. You can do this lying down. You can do this sitting in a chair. You can even, in some cases, people in their beds, they'll put their feet up on the wall and slide down with their feet on the wall. I go, but I'd have to move the table against that wall. So my feet are on the wall at home, maybe, if you're laying on your bed, and you're starting here, and you're just bringing your feet down, trying to slide them down. So that's doing a heel slide. Again, that's to get range of motion. Now, if I want to do a hamstring set, it looks similar. So I'm starting here. I start to slide my heel back, but then I stop. I lift my foot in the air, but I keep my heel on the ground, and I'm pulling my heel into the bed and as if I'm trying to pull it back towards my hamstring. And you'll feel your hamstring start to work. This is like a hamstring set, and then I relax. Need to be careful. You don't want to get that cramp in the hamstring. If it does, you got to kind of relax that and move on to another exercise. but you're just doing hamstring sets, okay? So that's 2 isometric exercises. The next exercise we talked about is the straight leg raise. Now the straight leg raise, what's really important with this is the setup. It's also, always very important. I'm laying on my back. I'm having my head turned to the camera, but really it should be straight with a chin tuck. I have the opposite leg knee bent. I put a little tension in my core again. Remember, we want the movement to feel like it's coming from a centered platform. So I have a little tension in my belly. I have a chin tuck. Now, what I'm doing is a quad set first to get this knee as straight as possible, and then I'm lifting the leg up as high as the other knee. And then I can either go up and down, or I can hold it for a little while. What's really important is you're moving the leg, don't let the back move. So that's how you want to do it, whether you're holding it for a while or going up and down. It's probably good to do a combination. We also talked about that. How many do you do? I always say do 1 set to fatigue. Fatigue means, 1, I can no longer keep my core activated. 2, my knee starts to bend. 3, I'm just getting really tired of doing these. Or 4, I get pain. Pain is never part of this. You never want to have especially sharp pain. Okay, so that's your straight leg raise on your back. Then we talked about straight leg raise on your side. Now I'm going to show you on this leg, since that's the closest one to the camera, because I turn this way, my back would be to you. So I'm laying on my side. I'm now going to work on my hip abductors, or the gluteus medius. We talked about this. So the setup for this is what we call a figure 4. The bottom leg is bent back. This leg is straight. Now, what we're going to do, core activate or align all the way straight down. You don't want the leg in the front. You don't want it back here, but especially not to the front. Leg straight down. I'm doing another straight leg raise, so I have another quad set, so my knee is straight, my foot is up, and I just lift the leg up. I hold, breathe in, breathe out, and down. I do 1 set to fatigue. If fatigue for this is I can't keep the knee straight, I'm losing my alignment up here, or I'm starting to notice my leg coming forward. That means the hip abductor, your gluteus medius, is getting tired and it's starting to use some other muscles that are stronger than that, okay? And the reason this muscle is so important is we talked about when you're walking, as I take a step, say on the left leg, for me to be able to bring this leg through without this falling down is not all, but a majority of that is making sure that that gluteus medius, that hip abductor, is strong enough to allow this leg to swing through. We talked about, polio patients, when they walk like this, and that's all compensations because of weakness in these muscles. Obviously, that's not your concern, but it's important that those muscles are strong to have a good walking cycle, okay? So that was those 2. The other one we talked about, so now we did the front of the thigh, we did the side here, and now we want to get the glute maximus. And the way you do that is through bridging. With bridging, I don't want 2 pillows. I'm laying on my back, feet both on the bed. They're not touching. They're aligned with my hips, meaning they're not here and they're not outside my hips. I put a little tension in my core. What I usually suggest is putting your hands palm up on here so your shoulders are rolled down, chin tuck, core activate, and then I lift my butt in the air. I hold it, breathe in, breathe out, and come down. Now again, be careful for cramping in the hamstrings. That's the first step. Ultimately, you can progress to doing lifting up, then maybe lifting one leg up, putting it down and come down, up, lift the other one up, come down and come down. So you're working, isolating single legs. Okay? What else did we talk about? So that was all that. Then we talked about doing squats. This you didn't do, but we just talked briefly about this. I had mentioned that this would be an exercise I wanted to get to today, but we didn't get to it. So with squats, I usually tell people to do it over a chair when you're first starting out. So we had said, go get a chair, make sure you're not by the rails. So you feel the chair against the back of both legs. And I had mentioned if the first thing that moves is your ankles, you're not going to do it correctly. Your form will be off. And we always talk about how important form is. The first thing you want to feel is your hips diving backwards. So it's this motion, right? I'm hip hinging. What that means is everything above the hip is moving as a unit over my hip. So I'm not rounding through my back. I'm making everything above the hip move as a unit. So if I push my hips backwards, Then what I want to do is I'm just going to fold down onto the front of my thighs. I want to get as low as I can, and as soon as I feel the chair, then I go back. Now, that's going to require a decent amount of range of motion in your knees and hips. So if you're not able to get there, you might have to build this up. So maybe you have a pillow or two when you're first starting these out, so they're more like mini squats. So let's just, for argument's sake, say that's probably too high. But say I'm here, I have to feel the chair against my legs, core activating, hips go backwards, I'm coming down, I feel the pillows, I come back up. That might be the first step. That's like a mini squat. As you get better, and you can go deeper with no pain and good technique, because sometimes when you don't get the range of motion, you may not recognize it. So maybe as I'm coming down, because this leg can't bend, I start to lean way over onto this side. We really don't want that. I would like, for now, be very symmetrical, okay? So that was the exercise you can start working on at home if you feel up to it. There's squats. Again, for that, I'd probably start out, I wouldn't even necessarily go to fatigue. I may start out just doing maybe 5 or 6 at a time. I'd rather those you do a few times a day for less rather than one time a lot. The other exercise we talked about, just doing your calf work. So we talked about against a wall. Again, chin tuck, core activate, standing tall. I'm here. I'm going to come up on my toes. I hold it for a good second or two. Again, we'll do it based on breath. Maybe a breath in, a breath out, and then I go back down. So that's step 1. You can then do it to progress it. You can do up with 2, lean over, lift, down with 1. Ultimately, the best way is lift the other, and we're just doing single legs. Way as high as I can, hold, come down slowly. Up, hold, come down slowly. You can do that on each side. When you're done, I strongly suggest maybe doing a little calf stretch, as we talked about. Remembering that foot is always facing forward, it's not turned down. There was one other one I do now remember that we talked about. I'm going to go back on the table. You had mentioned with your right leg, you have a tendency for that leg to roll in. And you had mentioned that you think it might have something to do with what happened to your knee. And that might be the case. But what's happening, where this is happening, is at your hip. You're internally rotating your leg. So the way you want to start working on that is fairly simple. Just do the opposite motion. So if I'm laying here and I feel that, once again, chin tuck, core activate. And then all I do is I would turn my leg out from here. So just kind of do that exercise. Bring it out, hold it, breathe in, breathe out, and go back to the middle. Don't go all the way back in. Go back to the middle. Then go out, and go back to the middle. And just do those maybe 5 to 10, few times a day. Just try to be conscious of that. The last thing we talked about, we talked about the bike. I think it's a very good idea for you to get one. You mentioned you might do it through Craigslist. And start building up that. In the very beginning, all we care about is that range of motion. We don't really care about the resistance. Obviously, you'll be back in so we can guide you through that. But I do believe that's everything we covered. If there's anything we're missing, I can always send you a new video. Never sharp pain. You got to expect, some discomfort in the knee as it gets better, but no sharp pain. Don't be concerned about the widths of your thighs and your calves. That'll all get better. And walk as much as you can, and I think that's it. Any questions, you know where you got us. See you next time. Good. That's pretty long.